Alright, so today we're going to do an NG tube placement. We check the medical records and we check the orders the patient needs one. So of course we come in and talk to the patient, let them know, hi, I'm your nurse today, I'm Lisa. Check their ID, name, date of birth, check their wristband, and discuss the NG tube that's going in. And it usually goes in for stomach pumping, or there's something in the stomach that's not wanted there, gas sometimes, or needing medications, whatever. So in the meantime, we're going to put the patient into a high collar position if they can, otherwise at least at a 45-degree angle.
Let's go the fuck home.
Okay. We're going to put a little napkin here, because what happens is when that NG tube hits the back of their throat, they're likely to gag. It's not pretty. We're going to open up our kit. We have, of course, our little syringe for aspirating, and our NG tube. And then, first thing we do is measure the NG tube. I'm actually going to cut a couple pieces of tape in advance as well, just because once we get it on there, we have to tape it in place. To measure the NG tube, we are going to go from the nose, around the ear, okay, and we're going down to patient's xiphoid process. So, just past right about there, okay. Check your policy. Some places tell you to add 10 centimeters to that, which would put us right about 5. Mark it. You can mark it with tape, or you can mark it with a pen. I happen to have a marker with me. Alright. You're going to get some jelly on the end of this tube. Okay. Keep it in. Get it nice and coated there. And then you can ask the patient which nostril they breathe through better. You can ask them if they have a deviated septum. You can look in and see the deviated septum with your pen light to see which nostril is better. If you meet a lot of resistance, don't continue. Try again. Okay, now if you go to the back of the mouth, your patient may keep gagging. This guy is not a good candidate for this. Okay, I might try the other nostril. You can use a tongue depressor to see in the back of the throat. I think I'm stuck. Okay. Once the NG tube is all the way in, if the person gags really quickly, you can actually give them a sip of water to help them kind of calm down. You can tell them, another thing is to have them keep swallowing while you put it in, so that you're getting it down the right area. If they start coughing, if they can't speak, or if they're having a hard time breathing, you might have it in the lungs instead of in the stomach area. To check this, we're going to what they call aspirate. And we're going to put our lovely syringe on the end here and pull out some stomach contents. Okay, we're going to put it in our little thing, and we're going to, and this is spacing, check it with our pH. We want a 5.5 to know that it's in the stomach. Okay, the other gold standard for this would be an x-ray. So in order to have that done, you would tape it to the patient's side of their face here and call, of course, your x-ray department, have them come in and do it. Once you have it verified that your tube is in the correct place,
Found it. I found it.
You do want to tape it into place. You don't want it coming back out. You may have to hold it too while you're doing this, which is why I cut my pieces of tape first. Oh, but I seem to mess it up. Alright, so I'll cut us another one. Because you want it to have these little legs on it
We're good.
to wrap around your NG tube to hold it in place. So you're going to pop that part on there, and then you're going to wrap one of them around and around and around, and then the same with the other. Alright, from here you can pin it to the patient. You're also going to probably want to suction at some point. Keep a hold of this. If you get rid of this, your people will hate you. And this is to allow air in. So this has to be higher than the patient in order for it not to leak out all over the place. Alright, so that's inserting an NG tube. To take out an NG tube, again, you're going to want to check placement. You can always flush with some saline. So at which point, you know, you kind of just put it in and throw some water in there, you know. You can always pull it out and aspirate it to check. Again, we're checking placement. We want to know that it's where it should be. Alright, and again, you're going to check the pH level with your handy dandy little litmus strip. You want it 5.5. To actually remove it, you're going to have your patient hold their breath. Okay, so you're going to instruct them to hold their breath. You're going to take all the little tape off as gently as you can. And then as they're holding their breath, you just pull it out hand over hand. Okay? And at which point, you should be able to kind of just leave it here, pile it all up, and throw it in the biohazard bag. Oftentimes when you pull it out, they're going to have some snot on it, so you may want to have some tissue ready, you know, or in case the MS has been, in case the patient also gets sick again. All right.